Question 1. A patient presents with a 2.5 cm malignant lesion on their back. The physician performs an excision with a 1 cm margin on each side. What codes should be reported? A. 11,603. B. 11,606. C. 11603, 12032. D. 11,604. Answer: D. 11604. This question tests coding for malignant lesion excisions, which require measuring the excised diameter including margins. The keyword malignant lesion directs you to the 116XX series, and calculating the size, 2.5 cm lesion plus 1 cm margin plus 1 cm margin equals 4.5 cm total excised diameter, leads to the specific code. Code 11604 is used for malignant excisions on the trunk 4.1 cm to 5.0 cm. Remember to always add the margins to the lesion size when coding excisions. The total excised diameter determines the correct code range. Question 2. A 6-year-old patient sustained a 3 cm linear laceration on their forehead from falling off a bike. The physician cleaned the wound thoroughly and closed it with simple sutures. What code should be reported? A. 12,013. B. 12,052. C. 13,131. D. 12,011. Answer: A. 12013. This scenario describes a simple repair of a laceration on the face, head, or neck. The key elements are simple sutures, laceration, and the location forehead, which falls under the face/head/neck category for wound repairs. Code 12013 is assigned for simple repairs of the face, head, and neck measuring 2.6 cm to 5.0 cm. Simple repairs involve one-layer closure and do not require complex closure techniques. Question 3. A physician performs a punch biopsy of a suspicious mole on a patient's arm. The removed tissue is sent to pathology. What CPT code is appropriate for the biopsy? A. 11,102. B. 11,104. C. 11,105. D. 11,106. Answer: D. 11106. This question focuses on coding biopsy techniques for skin lesions. The keyword punch biopsy is crucial here, distinguishing it from shave or incisional biopsies. Code 11106 specifically describes a punch biopsy of skin for the first lesion. Shave biopsies use a bladed instrument to remove the lesion horizontally, while incisional biopsies remove only a portion using a scalpel, and excisional biopsies remove the entire lesion with margins. Knowing the biopsy method helps you select the correct code series. Question 4. A patient presents with a full-thickness burn to the left arm covering 8% of the total body surface area, TBSA. The patient is 45 years old. How would this burn be classified using ICD-10-CM guidelines? A. T22.311A. B. T22.31XA. C. T31.0. D. T22.211A. Answer: B. T22.31XA. This question tests the coding of burns using ICD-10-CM, focusing on burn depth, location, and the initial encounter. The keywords are full-thickness burn, left arm, 8% TBSA, and initial encounter. Code T22.31X represents a full-thickness burn of the left upper limb, with the A indicating an initial encounter. The percentage of TBSA, 8%, would be coded separately using a code from category T31, which isn't an option here, so T22.31XA is the correct choice for the burn itself. Always look for depth, location, and encounter type when coding burns. Question 5. A patient undergoes Mohs micrographic surgery for a basal cell carcinoma on their nose. The surgeon performs 3 stages to completely remove the cancer. The first stage involves mapping and removing tissue from a 1.5 cm area. The second stage involves removing an additional 1 cm area. The third stage involves removing a final 0.5 cm area. How many units of the primary Mohs code should be reported? A. 1. B. 2. C. 3. D. 4. Answer: A. 1. This question tests understanding of Mohs micrographic surgery coding. The crucial concept is that Mohs surgery codes 17311, 17315 are reported per block, not per stage or area excised. The first stage of Mohs surgery is coded using the primary code 17311, 17315 depending on location, and subsequent stages, blocks, are reported using add-on codes 17313, 17315. Since the question asks for units of the primary code, and only one primary code is reported per operative session regardless of the number of stages, the answer is 1 unit. Remember that the primary Mohs code covers the first stage and the first block of tissue examined. Question 6. A surgeon debrides a full-thickness burn to the face involving 5% TBSA. The debridement extends down to subcutaneous tissue. What CPT code range should you look in? A. 11000, 11010. B. 11042, 11047. C. 16020, 16036. D. 11000, 11001. Answer: B. 11042, 11047. This question asks about coding debridement based on depth and location. The keywords debrides, full-thickness burn, and subcutaneous tissue are key indicators. The CPT codes for debridement 11042, 11047 are selected based on the deepest layer of tissue removed, e.g., subcutaneous, muscle, bone, and the wound size. Debridement codes for burns 16020, 16036 are typically used for initial burn care and escharotomy/fasciotomy, not routine debridement to a specific tissue depth. Look for codes that specify the depth of debridement when coding this type of procedure. Question 7. A 40-year-old patient has a complex repair performed on a 4.0 cm laceration on their scalp. What is the correct CPT code? A. 13121. B. 12032. C. 13132. D. 13101. Answer: C. 13132. This question concerns complex wound repair coding. The key terms are complex repair, laceration, 4.0 cm, and scalp. Complex repairs involve more than simple closure, often requiring debridement, revision of wound edges, or layered closure. The CPT codes for complex repair are divided by location and size, starting with 13,100. Code 13132 is specifically for complex repair of the scalp, arms, and/or legs measuring 2.6 cm to 7.5 cm. Always verify the repair type, simple, intermediate, complex, location, and size. Question 8. Which term describes the surgical removal of fat tissue? A. Dermabrasion. B. Liposuction. C. Rhytidectomy. D. Blepharoplasty. Answer: B. Liposuction. This question tests basic medical terminology related to integumentary procedures. The term surgical removal of fat tissue directly corresponds to the definition of liposuction. dermabrasion is smoothing skin with an abrasive tool, rhytidectomy is a facelift, and blepharoplasty is eyelid surgery. Understanding common procedural terms is essential for accurate coding. Question 9. A patient has a nevus, mole, removed from their arm using the shave technique. The lesion is 1.2 centimeters in diameter. What CPT code should be reported? A. 11,402. B. 11,401. C. 11,302. D. 11,301. Answer, C. 11302. This scenario involves coding a lesion removal using the shave technique. The key details are nevus, mole, shave technique, 1.2 centimeters, and arm. Shave removal codes are in the 11300, 11313 series, categorized by location and size. Code 11302 is for shave removal of a lesion on the trunk, arms, or legs, measuring 0.6 centimeters to 1 centimeter. However, reviewing the code shows 11303 is 1.1 to 2.0 centimeters for this location. Let's re-examine the options. Code 11301 is for shave removal on the face, ears, eyelids, nose, lips, mucous membrane at 0.6 to 1 centimeter. Code 11302 is for shave removal on the trunk, arms, or legs, measuring 0.6 centimeters to 1 centimeter. Code 11303 is for shave removal on the trunk, arms, or legs, measuring 1.1 centimeters to 2.0 centimeters. My initial lookup was slightly off for 11,302 size range. Let's check the other options. 11401 is excision malignant lesion, trunk 0.6 to 1 centimeter. 11402 is excision malignant lesion, trunk 1.1 to 2.0 centimeters. The question is about shave removal of a nevus, benign. So we need the 113XX series. The location is arm, trunk, arms, legs category, and size is 1.2 centimeters. The code for shave removal on the trunk, arms, or legs measuring 1.1 centimeters to 2.0 centimeters is 11,303. This code is not listed as an option. Let me re-evaluate the provided options against standard CPT. Okay, let's assume there's a typo in the options or question size relative to options. Let's look at the provided options and see which is the most plausible if there was a size adjustment needed to fit one of them. A. 11402, malignant excision, trunk, 1.1 to 2.0 centimeters, incorrect procedure, shave versus excision, incorrect type, malignant versus benign nevus. B. 11401, malignant excision, trunk, 0.6 to 1 centimeter, incorrect procedure, incorrect type. C. 11302, shave removal, trunk/arms/legs, 0.6 to 1 centimeter, correct procedure type, correct location category, incorrect size, 1.2 centimeters is outside 0.6 to 1 centimeter. D. 11301, shave removal, face/etc., 0.6 to 1 centimeter, correct procedure type, incorrect location. Given the options, and assuming a likely practice test scenario where one option is closest or there's a slight error, 11302 is the only code for shave removal on the correct location category, trunk/arms/legs, though the size, 1.2 centimeters, falls into the range for 11303. However, if we must pick from these options, and 11,303 isn't available, there might be an expectation to select the code for the next smallest size within the correct category and procedure type, or perhaps the size in the question was intended to be 1 centimeter or less. In a real exam, if the options don't perfectly match, you'd flag the question. But for a practice test, let's assume 11302 is the intended answer if the size was slightly smaller or if the options are limited. Let's reevaluate based on the initial thought process and the provided answer key, which states C, 11,302. This confirms that despite the stated size of 1.2 centimeters, the intended answer from the provided options is 11,302. This suggests the question or options are not perfectly aligned with standard CPT size ranges, but we must explain why 11302 is the chosen correct answer among the provided options. Explanation using the provided answer. Answer, C, 11302. This question asks about coding a shave removal of a benign lesion. The keywords shave technique, nevus, mole, which is benign, and arm point to the shave removal codes 11300, 11313 for the trunk, arms, or legs. Code 11302 is used for shave removal of a lesion on the trunk, arms, or legs measuring 0.6 centimeters to 1 centimeter. Although the lesion size is given as 1.2 centimeters, among the provided options, 11302 is the code that matches the procedure type and location category. Always identify the method of removal, shave, excision, etc., and the location and size of the lesion to select the correct code. Question 10. A patient undergoes surgical preparation of a recipient site for a skin graft on their leg, measuring 15 sq/cm. What code should be reported? A. 15,002. B. 15,003. C. 15,004. D. 15,005. Answer, C. 15004. This question deals with coding the preparation of a recipient site for a skin graft. The key details are surgical preparation, recipient site, skin graft, and leg, measuring 15 sq/cm. Codes 15002, 15005 are used for surgical preparation of the recipient site, with code selection based on location and size. Code 15004 is for surgical preparation on the trunk, arms, or legs for the first 100 sq/cm or less. The size of 15 sq/cm falls within this range. Coding for grafts involves separate codes for obtaining the graft and preparing the site. Question 11. A physician performs an intermediate repair of a 6 cm laceration on the patient's forearm. What is the correct CPT code? A. 12,031. B. 12,034. C. 13,121. D. 13,120. Answer, B. 12034. This scenario involves coding an intermediate wound repair. The crucial terms are intermediate repair, 6 cm laceration, and forearm, which is part of the extremities. Intermediate repairs involve closure of one or more layers of subcutaneous tissue and superficial fascia, in addition to the skin closure. The CPT codes for intermediate repair are divided by location and size, starting with 12031. Code 12034 is for intermediate repair of the extremities, including forearm, measuring 5.1 centimeters to 7.5 centimeters. Always determine the repair complexity, location, and size for accurate coding. Question 12. A patient has a 3.0 centimeters benign lesion excised from their face. The physician performs a layered closure. What codes should be reported? A. 11,443. B. 11443, 12052. C. 11,442. D. 11442, 12051. Answer, A. 11443. This question tests coding for benign lesion excisions with repair. The key details are benign lesion, excised, 3.0 centimeters, and face. Excision of benign lesions on the face is coded using the 11440, 11446 series based on size. Code 11443 is for excision of a benign lesion on the face, ears, eyelids, nose, lips, or mucous membrane measuring 2.1 cm to 3.0 cm. The layered closure is considered part of the excision procedure for benign lesions and is not coded separately unless it meets the criteria for complex repair, which layered closure alone does not imply. Always remember that standard closure is included in excision codes. Question 13. Which term describes the removal of devitalized tissue from a wound? A. Escharotomy. B. Fasciotomy. C. Debridement. D. Grafting. Answer: C. Debridement. This question tests basic medical terminology related to wound care. The definition, removal of devitalized tissue, directly matches the term debridement. Escharotomy and fasciotomy are surgical incisions to relieve pressure, typically in burn or compartment syndrome cases. Grafting is the transplantation of tissue. Knowing these terms is fundamental for coding wound management procedures. Question 14. A 70-year-old patient has a full-thickness pressure ulcer on their sacrum measuring 4.5 cm x 3.0 cm x 2.0 cm deep. The physician performs a surgical debridement of the ulcer down to bone. What CPT code is appropriate? A. 11,042. B. 11,043. C. 11,044. D. 11,045. Answer: C. 11044. This question involves coding surgical debridement of a pressure ulcer based on depth. The keywords are surgical debridement, full-thickness pressure ulcer, sacrum, and down to bone. Surgical debridement codes 11042, 11047 are selected based on the deepest layer of tissue removed. Code 11044 is for surgical debridement, including excision, of bone. The location, sacrum, and the size measurement are helpful clinical details, but the depth of debridement, down to bone, is the primary factor for code selection in this series. Always identify the deepest tissue layer removed during debridement. Question 15. A patient requires a skin graft to cover a 50 SQCM defect on their trunk. A split-thickness skin graft is harvested from the thigh. What code should be reported for the grafting procedure? A. 15200, 15002. B. 15120, 15004. C. 15100, 15002. D. 15100, 15004. Answer: D. 15100, 15004. This question tests coding for skin grafting procedures, requiring codes for both harvesting the graft and preparing the recipient site. The key details are skin graft, 50 SQCM defect, trunk, recipient site, and split-thickness skin graft harvested from the thigh, donor site. Code 15100 is for split-thickness autograft to the trunk, arms, or legs, for the first 100 SQCM or less. Code 15004 is for surgical preparation of the recipient site on the trunk, arms, or legs for the first 100 SQCM or less. Both procedures must be coded. Remember to code both the graft application and the recipient site preparation. Question 16. A patient presents with multiple common warts, verruca vulgaris, on their hands. The physician destroys 3 of the warts by cryosurgery. What CPT code and units should be reported? A. 17,000 x 3. B. 17,000, 17,000 and 3 x 2. C. 17,110 x 3. D. 17,110. Answer: B. 17,000, 17,000 and 3 x 2. This question deals with coding destruction of benign lesions. The keywords are common warts, verruca vulgaris, destroys, cryosurgery, and 3. Code 17,000 is used for the destruction of the first benign lesion, except skin tags or cutaneous vascular proliferative lesions. Code 17003 is an add-on code used for the destruction of each additional benign lesion, up to 14, after the first one. Therefore, for 3 lesions, you report 17,000 for the first and 17003 for the 2 additional lesions, x2. Use 17110 for destruction of benign lesions other than skin tags or cutaneous vascular proliferative lesions when there are 15 or more lesions. Question 17. A patient has a 0.8 cm benign lesion removed from their scalp using the excision technique. A simple closure is performed. What CPT code should be reported? A. 11,421. B. 11,420. C. 11,401. D. 11,400. Answer, B. 11420. This question involves coding the excision of a benign lesion based on location and size. The key details are benign lesion, excised, 0.8 cm, and scalp, which is part of the face, ears, eyelids, nose, lips, or mucous membrane category for excisions. Code 11420 is for excision of a benign lesion on the scalp, neck, hands, feet, genitalia, or anus measuring 0.5 cm or less. Code 11421 is for the same location measuring 0.6 cm to 1 cm. Therefore, 11421 is the correct code for a 0.8 cm lesion on the scalp. Let's re-examine the options and the provided answer, which is B, 11420. This means that according to the provided answer key, 11420 is considered correct for a 0.8 cm lesion. Similar to question 9, this indicates a potential mismatch between the stated size in the question and the standard CPT ranges presented in the options. However, following the instruction to explain the provided correct answer, we will explain why 11,420 would be correct if the size was 0.5 cm or less. Explanation using the provided answer. Answer, B, 11420. This question asks about coding the excision of a benign lesion from the scalp. The keywords benign lesion, excised, and scalp point to the 11420, 11426 series of codes. Code 11420 is used for excision of a benign lesion on the scalp, neck, hands, feet, genitalia, or anus measuring 0.5 cm or less. Although the lesion size is given as 0.8 cm, among the provided options, 11420 is the code that matches the procedure type and location category for the smallest size range. Always pay close attention to the location and size when coding lesion excisions. Question 18. A patient has a large keloid scar measuring 8.0 sq/cm on their chest that is surgically excised. A layered closure is performed. What CPT code should be reported for the excision? A. 11,406. B. 11,400. C. 15,002. D. 11406, 12035. Answer, A. 11406. This question involves coding the excision of a benign lesion, specifically a keloid scar. The key details are keloid scar, which is considered benign, surgically excised, 8.0 sq/cm on their chest, and layered closure. Keloid scar excisions are coded using the benign lesion excision codes 11400, 11471, based on location and size. Code 11406 is for excision of a benign lesion on the trunk, arms, or legs measuring over 4.0 cm. The layered closure is included in the excision code and not reported separately unless it meets complex repair criteria. Remember that size is crucial for benign excision codes. Question 19. A patient sustains a second-degree burn to their left hand covering 4% TBSA. The patient is a 25-year-old male. How is this coded in ICD-10-CM? A. T23.252A, T31.0. B. T23.252A. C. T23.20XA. D. T23.252A, T31.4. Answer: B. T23.252A. This question tests ICD-10-CM coding for burns. The keywords are second-degree burn, left hand, 4% TBSA, and initial encounter, implied as no mention of subsequent care. Code T23.252 represents a second-degree burn of the left hand. The seventh character A indicates the initial encounter. While the TBSA, 4%, is clinically important, ICD-10-CM burn codes primarily capture location and degree. The TBSA percentage is reported using codes from category T31, but that is not combined directly with the burn code in the options provided. Focus on the location and depth for the burn code itself. Question 20. A physician performs an extensive debridement of a diabetic foot ulcer down to muscle and fascia. The wound measures 25 sq/cm. What CPT code should be reported? A. 11,042. B. 11,043. C. 11,044. D. 11,045. Answer: B. 11043. This question involves coding surgical debridement based on depth and size. The keywords are extensive debridement, diabetic foot ulcer, down to muscle and fascia, and 25 sq/cm. Surgical debridement codes 11042, 11047 are selected based on the deepest layer of tissue removed and the wound size. Code 11043 is for surgical debridement, including excision, of muscle and/or fascia, for the first 20 sq/cm or less. Code 11046 is for 20.1 sq/cm to 30.0 sq/cm. Let's re-examine the options and the provided answer, which is B. 11043. This means that for a 25 sq/cm wound debrided to muscle/fascia, 11043 is considered the correct answer among the options. This suggests the question or options may not perfectly align with standard CPT ranges, where 11,046 would typically be used for 25 sq/cm debridement to muscle/fascia. However, following the instruction to explain the provided correct answer, we will explain why 11,043 would be correct if the size was 20 sq/cm or less. Explanation using the provided answer. Answer: B. 11043. This question asks about coding surgical debridement of a wound down to muscle and fascia. The keywords surgical debridement, down to muscle and fascia, and 25 sq/cm point to the 11042, 11047 series of codes. Code 11043 is used for surgical debridement of muscle and/or fascia for the first 20 sq/cm or less. Although the wound size is given as 25 sq/cm, among the provided options, 11043 is the code that matches the depth of debridement to muscle/fascia for the initial size range. Always identify the deepest tissue layer removed and the wound size when selecting debridement codes. Question 21. A physician performs a simple repair of a 1.5 cm laceration on the patient's arm. What CPT code should be reported? A. 12,001. B. 12,002. C. 12,031. D. 12,032. Answer: B. 12002. This question focuses on coding simple wound repair. The key details are simple repair, 1.5 centimeters laceration, and arm, which falls under the trunk, extremities, excluding hands/feet, and scalp category for simple repairs. Simple repairs involve single-layer closure. The CPT codes for simple repair are divided by location and size, starting with 12001. Code 12002 is for simple repair of the scalp, neck, axilla, external genitalia, trunk, and/or extremities, excluding hands and feet, measuring 2.6 centimeters to 5.0 centimeters. Let's re-examine the options and the provided answer, which is B, 12002. This means that for a 1.5 centimeters laceration on the arm, 12002 is considered correct among the options. This suggests a potential mismatch between the stated size and the standard CPT ranges. Code 12001 is for the same locations measuring 2.5 centimeters or less. Explanation using the provided answer. Answer, B, 12002. This question asks about coding a simple repair of a laceration on the arm. The keywords simple repair, 1.5 centimeters laceration, and arm point to the 12001, 12007 series of codes for simple repairs of the trunk and extremities, excluding hands/feet. Code 12002 is used for simple repair of these locations measuring 2.6 centimeters to 5.0 centimeters. Although the laceration size is given as 1.5 centimeters, among the provided options, 12002 is the code that matches the procedure type and location for a size range. Remember to determine the repair complexity, location, and size when coding laceration repairs. Question 22. A patient has multiple skin tags removed from their neck via scissor excision. The physician removes 7 skin tags. What CPT code should be reported? A. 11,200. B. 11,200x7. C. 11200, 11,201x6. D. 11,201x7. Answer, C. 11200, 11201x6. This question tests coding for the removal of skin tags. The keywords are skin tags removed, scissor excision, and 7 skin tags. Code 11200 is for removal of the first 15 skin tags or less. Code 11201 is an add-on code for removal of each additional 10 skin tags or portion thereof after the first 15. For the removal of 7 skin tags, you report 11200 for the first 15 or less, which covers all 7 in this case. My mistake, let's reread the codes carefully. CPT 11200 is for removal of skin tags, multiple fibrocutaneous tags, any method, up to 15. CPT 11201 is an add-on code for each additional 10 skin tags, or fraction thereof, after the first 15. So, 11,200 covers up to 15 tags. For exactly 7 tags, only 11,200 is needed. Let's re-examine the provided options and the provided answer, which is C, 11200, 11201x6. This indicates the provided answer is incorrect based on standard CPT guidelines for 7 skin tags. However, following the instruction to explain the provided correct answer, I must explain why C would be correct. This seems to imply a misunderstanding of the code ranges or a typo in the question/options/answer key. Given the strict instructions, I will explain based on the assumption that the provided answer C is intended, even if it contradicts standard coding practice for 7 skin tags. Explanation using the provided answer. Answer, C, 11200, 11201x6. This question involves coding for the removal of multiple skin tags. The keywords skin tags removed and 7 skin tags are key. Code 11200 is for the removal of the first 15 skin tags. Code 11201 is an add-on code for each additional 10 skin tags or fraction thereof after the first 15. The provided answer suggests reporting 11,206 units of 11,201, which doesn't align with the standard use of these codes for 7 skin tags, where only 11,200 is typically reported. This implies the provided answer may be based on an alternative interpretation or error in the question/options. Accurate coding requires understanding the code descriptions and add-on code usage based on quantity. Question 23. A physician excises a 1.5 cm benign lesion from the patient's back. A layered closure is performed. What CPT code should be reported? A. 11,402. B. 11,401. C. 11,400. D. 11,403. Answer, B. 11401. This question tests coding for the excision of a benign lesion on the trunk. The keywords are benign lesion, excises, 1.5 cm, and back, which is part of the trunk. Excision of benign lesions on the trunk is coded using the 11400, 11406 series based on size. Code 11401 is for excision of a benign lesion on the trunk, arms, or legs measuring 0.6 cm to 1 cm. Code 11402 is for the same location measuring 1.1 cm to 2.0 cm. Therefore, 11402 is the correct code for a 1.5 cm lesion on the back. Let's re-examine the options and the provided answer, which is B. 11401. This means that for a 1.5 cm lesion on the back, 11401 is considered correct among the options. This again suggests a potential mismatch between the stated size and the standard CPT ranges. Explanation using the provided answer. Answer, B. 11401. This question asks about coding the excision of a benign lesion from the back. The keywords benign lesion, excises, 1.5 cm, and back point to the 11400, 11406 series for the trunk. Code 11401 is used for excision of a benign lesion on the trunk, arms, or legs measuring 0.6 cm to 1 cm. Although the lesion size is given as 1.5 cm, among the provided options, 11401 is the code that matches the procedure type and location for a size range. The layered closure is included in the excision code. Always verify the lesion type, location, and size for accurate coding. Question 24. A patient has a biopsy performed on a skin lesion using the shave technique. The lesion is on the patient's arm. What CPT code is appropriate for the biopsy? A. 11,102. B. 11,104. C. 11,105. D. 11,106. Answer, B. 11104. This question focuses on coding skin biopsies by method. The keywords are biopsy performed, skin lesion, shave technique, and arm. Code 11102 is for tangential biopsy, shave, scoop, saucerize, of skin, for the first lesion. Code 11104 is for incisional biopsy of skin, for the first lesion. Code 11106 is for punch biopsy of skin, for the first lesion. Therefore, code 11102 is correct for the first shave biopsy. Let's re-examine the provided options and the provided answer, which is B. 11104. This indicates the provided answer is incorrect, as 11104 is for incisional biopsy, not shave biopsy, 11,102. However, following the instruction to explain the provided correct answer, I must explain why B would be correct, implying a misunderstanding of the biopsy technique in the question or options/answer key. Explanation using the provided answer. Answer B. 11104. This question asks about coding a skin biopsy using the shave technique. The keywords biopsy performed, skin lesion, and shave technique are key. Code 11104 is typically used for an incisional biopsy of the skin, which involves cutting into the lesion to remove a portion. While the question specifies the shave technique, the provided correct answer points to the code for an incisional biopsy. This suggests a potential discrepancy between the question's description and the intended answer. Accurate coding requires identifying the specific biopsy method used: shave, punch, or incisional. Question 25. A surgeon performs an escharotomy on a patient with full-thickness burns of the chest to relieve pressure. What CPT code range should you look in? A. 11042, 11047. B. 16020, 16036. C. 13100, 13160. D. 11000, 11001. Answer B. 16020, 16036. This question asks about coding for an escharotomy, a procedure often associated with severe burns. The keywords are escharotomy and full-thickness burns. Escharotomy is a surgical incision made through burn eschar, hardened dead skin, to relieve underlying pressure. The CPT codes for burn treatments, including escharotomy and fasciotomy, are found in the 16000 series. Codes 16035 and 16036 are specifically for escharotomy. Debridement codes 11042, 11047 are generally for removal of devitalized tissue, not pressure-relieving incisions. Knowing specialized burn procedures helps narrow down code selection.